Hello, I'm Robert Rintoul and I'm a lung cancer specialist working in the University of Cambridge where I undertake research and the Royal Papworth Hospital where I see patients in clinic. Well, lung cancer is one of the major cancers in the UK currently. And unfortunately, more people die of lung cancer than any other cancer. One of the problems we have is that many of the people, around about 3/4 of people who come to us in the clinic, already have quite advanced disease, and our options for treating them are as a result more limited. However, if we can catch cancer at an early stage, the chance of curing it is much, much better. So what we need to do is try and find ways of identifying lung cancer at a much earlier stage when it's much smaller, so the size of my little fingernail, for instance, rather than the size of my fist. And that will give us far more options such as lung cancer operations and other treatments, so we can actually cure people long term. We're developing a number of different approaches for trying to diagnose lung cancer at an earlier stage. In the research setting, we're undertaking clinical trials to see if we can actually identify people with lung cancer using their exhaled breath. Can we look at people's breath and try and distinguish between people who have got lung cancer and people who haven't got lung cancer? Another approach we're taking is looking at people's blood from their arm. Within our blood, we have DNA. Most of the DNA is the DNA from all the cells in our body. But cancer cells also have their own special DNA called tumour DNA. And we're trying to develop very sensitive approaches for looking at the blood to try and pick out the tumour DNA from all the other DNA. And again, see if we can develop a way for identifying patients who have lung cancers against those who don't. We already know that we can do this. We can certainly do it for people with large tumours, but actually what we want to do is develop more and more sensitive approaches so that we can develop and identify little tumours the size of my fingernail rather than big ones the size of my fist. And we're making very good progress along those lines. A third approach, which is already being used clinically, is using CT scans, putting people in a CT scanner and doing a scan of their chest to see if we can find lung cancers. For a number of years, this has been the subject of a programme called the Targeted Lung Health Checks, which started just before the pandemic. Essentially, what happens is that people are identified from their GP health records, and we're looking at people who have got a smoking history, who are aged between 55 and 75. And we invite those people along either by letter or by telephone to participate in a lung health screen. Essentially, people are asked a number of questions. And if following those questions it's felt that they are of sufficiently high risk and at risk of lung cancer, they're then invited to undertake a CT scan. The CT scan is then looked at by experts, and if any abnormalities are seen on the scan, they're then invited to come to the clinic to discuss the results. If we think they might have a lung cancer, they may require further tests to confirm that. Most people having these scans will actually have a normal scan, but we know from our experience that actually the lung cancers that we're picking up are early stage ones, not late stage, which is exactly what we want to do. Since the beginning of February, the previously named Lung Health Check Programme has been renamed the Lung Cancer Screening Programme. So far, since about 2019, nearly 2 million people have been invited for a lung health check. About 1 million have participated and about 500,000 have had a CT scan. And so far we've found nearly 5,000 lung cancers. And the majority of those have been small early stage lung cancers. And we've been able to offer those people treatments such as a lung cancer operation to cure them and get rid of the cancer completely. And this is a big, big step forward for helping cure lung cancer. I think the future for the early detection of lung cancer is very exciting. If we go back 20 or 30 years, unfortunately then the majority of people who came to my clinic, for instance, with lung cancer had advanced large tumours. And although we could treat them, the things we could do were relatively limited. And unfortunately, many people died after a few months or a year or two. We're now in a new era. Using approaches such as CT screening for lung cancer, we're going to find more and more lung cancers at an early stage, small ones, where we can actually offer people far more treatment, such as lung cancer operations or X-ray treatment, to kill the cancers and actually allow people many, many years of good quality life. CT screening, which as I said has been going for a few years now, following some large clinical trials which proved it worked. We're rolling it out across England over the next few years. Hopefully other nations such as Scotland, Northern Ireland and Wales will follow suit. This is the largest, the biggest game changer for detection of lung cancer in a generation. Going forward, we are going to push the long-term survival rates for lung cancer up much, much higher than they've ever been before. There will be other approaches, I think, which will come to the fore, such as blood tests or breath tests. A lot more research needs to be done to see how those will fit in. But, looking to the future, gazing into the crystal ball, as it were, I can see the day when people go to their general practitioner, the GP does a health check on them, maybe takes a blood test or a breath test, asks some questions, looks at their risk for lung cancer, invites them to have a CT scan, and if they have lung cancer, we find it at an early stage. And I think over the next 10, 20, 30 years, the statistics around who survives lung cancer is going to change very, very dramatically. We are living in an exciting time.